Regenerative medicine, it might just be what people need to solve some of their biggest problems, but what are those problems? Dr. Tammy Penhollow is joining me from Arizona today. All right, Dr. Tammy, jump right in. Explain to me, first off, what is regenerative medicine?
Regenerative medicine is a newer field where we utilize the body's own cells to treat painful conditions. Think joint pain, knees, hips, shoulders, even the small joints of the hands and feet, and spine pain in the neck or the low back.
Now, you would know this better than me, and most people told, oh, you need surgery, you need medication right away. What do you tend to recommend first? I know I'm asking you in a general way. Every patient's different.
Every patient is different, but I love to see patients who want to ask that question before they jump for surgery. I like to see patients and give them a second opinion and say, maybe you don't have to go for that surgery because maybe you're at a point where you're not bone on that knee, and there's an ability to get in there and get some strong anti-inflammatory mediators from your own blood or your own bone marrow, some strong cytokines that can actually help rebuild some of the tissues, provide a little bit more cushion, and either buy time until you need a surgery or completely prevent you from having to have surgery and not having to take any pills. So there's no real side effects. You're using your own body's cells.
Okay, so you mentioned knees and joints. So what do you help people with the most?
I'd say that arthritis is a very broad condition. Even if you talk about low back pain, or I've got a disc bulge, or I've got spinal stenosis, or bone on bone in my knee, it's all a fancy term for arthritis or the wear and tear that's happened over time. This is separate from rheumatoid arthritis, which is an inflammatory condition that is the body against itself, or autoimmune, which doesn't respond as well to regenerative medicine. I'm talking osteoarthritis, the run-of-the-mill everyday arthritis that most people have. So it's wear and tear over years. It's wear and tear from extra body weight, for example, putting extra strain and decreasing the cushioning on those discs in the back or on the joints in the knee or the hips. And it's putting a little bit more cushioning and a little bit more healing stuff within those joints themselves, including the back.
And how would people even know to go and have a consult with you when the thought is they're just getting a recommendation to go to whoever's friend is a friend of their doctor? How would they even know?
I think they know because maybe they're tired of the pills, they're tired of the surgery, or they know right now that steroids aren't that great for you. And in the COVID situation, that steroids can actually decrease your immune system. And who wants that right now? We need our immune systems to be as strong as they can be. So they're looking for something different, and they're looking for something that is not destructive. Characteristically, surgeries are destructive. Radiofrequency ablations, steroid injections are all destructive, and they want to turn the corner. They want something different that's going to be constructive or rebuilding, and this is a long-term, long-haul thing. So they know that by doing a little search on this, going on different web pages, and making sure that they're finding a doc that's using their own body cells. That's the only thing right now that is actually legit in terms of not having to have FDA approval. If you're looking at things like amniotic cells, cord blood cells, other person's stem cells, or even the word stem cells injected into the body that aren't yours, there's absolutely no FDA approval for this, and there are some bad actors out there. So it's important that patients look and do some research and find somebody in the keywords of autologous, or your own cells and your own blood or your own bone marrow.
Okay, so if people have questions, they're specific to themselves and they're trying to find somebody or want to reach out, what should they do?
Absolutely. I see patients virtually, I see patients in person, and it's really neat in this time. It's so robust to have these telemedicine systems that I can see patients from other states. So I recommend you reach out to us. We're at Precision Regenerative Medicine, both on Facebook, on Instagram, or on our webpage, precisionmedprp.com. And we'd love to set up an appointment with you just to talk and see whether or not this might be ideal for you and your pain. And let's get you back out there.
Well, we appreciate you sharing. Dr. Tammy Penhollow, thanks for being here.
Thank you so much.